duties associated with controls and contingency plans. All office-based businesses must have contingency plans to ensure effective emergency operating procedures in the case of an infectious disease incident, an infectious disease outbreak, an infectious disease catastrophe. An incident could be the risk scenario associated with an employee, customer, visitor, or contractor displaying the signs and symptoms of a disease. An outbreak could be the risk scenario of an outbreak of an infectious disease in 2 or more people who are linked through the environment. A catastrophe could also be the risk scenario of a pandemic across the region or country, such as the recent coronavirus pandemic known as COVID-19. Office and contact centre based businesses will list similar scenarios in their overall risk assessment, controls and contingencies. Each organisation will do this by considering the nature of their own environment, infrastructure and stakeholders. We will use the scenarios outlined above in this digital learning experience to support development in this area. Duties associated with infectious disease incidents. In business, the HSE have RIDDOR regulations that govern reporting of infectious disease incidents. Reportable diseases. Regulation 8 requires employers and self-employed people to report cases of certain diagnosed reportable diseases which are linked with occupational exposure to specific hazards. The reportable diseases and associated hazards are set out below. Carpal tunnel syndrome, where the person's work involves regular use of percussive or vibrating tools. Cramp of the hand or forearm, where the person's work involves prolonged periods of repetitive movement of the fingers, hand or arm. Occupational dermatitis, where the person's work involves significant or regular exposure to a known skin sensitizer or irritant. Hand-arm vibration syndrome, where the person's work involves regular use of percussive or vibrating tools, or holding materials subject to percussive processes or processes causing vibration. Occupational asthma, where the person's work involves significant or regular exposure to a known respiratory sensitizer. Tendinitis or tenosynovitis in the hand or forearm, where the person's work is physically demanding and involves frequent repetitive movements. These have been selected due to these being the most frequent cause of lost time due to work-related diseases. Duties associated with infectious disease incidents. Where a significant infectious disease is prevalent, RIDDOR gives specific guidance. We use the recent COVID guidance to illustrate the reporting guidance given to the responsible officer, usually the employer. Members of the public and non-work related cases. There is no requirement under RIDDOR, the Reporting of Injuries, Diseases and Dangerous Occurrences Regulations 2013, to report incidents of disease or deaths of members of the public, patients, care home residents or service users from COVID-19. The reporting requirements relating to cases of or deaths from COVID-19 under RIDDOR apply only to occupational exposure, that is, as a result of a person's work. What to report? You should only make a report under RIDDOR when one of the following circumstances applies. An accident or incident at work has or could have led to the release or escape of coronavirus. This must be reported as a dangerous occurrence. A person at work has been diagnosed as having COVID-19 attributed to an occupational exposure to coronavirus. This must be reported as a case of disease. A worker dies as a result of occupational exposure to coronavirus. This must be reported as a work-related death due to exposure to a biological agent. Duties associated with infectious disease incidents. Riddle circumstances in detail. Dangerous occurrences. Dangerous occurrences are certain unintended specified events which may not result in a reportable injury but which do have the potential to cause significant harm. For an incident to be reportable as a dangerous occurrence, the incident must have resulted or could have resulted in the release or escape of coronavirus, that is, led to a possible or actual exposure to coronavirus. The assessment does not require any complex analysis, measurement or test, but rather for a reasonable judgment to be made as to whether the circumstances gave rise to a real risk or had the potential to cause significant harm. Cases of disease. Exposure to a biological agent. When deciding if a report is required, the responsible person, usually the employer, must make a judgment based on the information available as to whether or not a confirmed diagnosis of COVID-19 is likely to have been caused by an occupational exposure, that is, whether or not there is reasonable evidence that a work-related exposure is the likely cause of the disease. The report should specify a disease due to exposure to a biological agent and use the case of disease report form. Work-related deaths due to exposure to a biological agent. For an incident to be reportable as a death due to occupational exposure to coronavirus, there must be reasonable evidence that a work-related exposure caused the worker's death. The responsible person should notify the enforcing authority by the quickest practicable means without delay and send a report within 10 days. The report should specify death due to exposure to a biological agent using the case of disease report form. Duties associated with infectious disease outbreaks. In the event of a suspected infectious disease outbreak, employers and line managers should contact their local health protection team immediately, discuss the situation, and agree any actions. Outbreaks are defined as an incident in which 2 or more people experiencing a similar illness are linked in time or place, a greater than expected rate of infection compared with the usual background rate for the place and time where the outbreak has occurred. Outbreak examples include 2 or more cases of diarrhea or vomiting which are in the same office, shared communal areas, or taking part in the same activities. Duties associated with infectious disease outbreaks. Here are some examples of contingencies that may be put in place in the event of an outbreak. Exclusion of those infected, deep cleaning out of office hours with no changes to usual working practices and monitoring. Exclusion of those infected, deep cleaning, increased hygiene practice, significant change to working practice and monitoring. Whole business closure, remote working where possible, and deep cleaning and monitoring prior to reopening. Every contingency must be supported with clear communication across all stakeholders to prevent further transmission and to stop the spread of infection. Duties associated with infectious disease catastrophes. In the event of an infectious disease catastrophe, which we have defined as a pandemic, senior management must follow infection and outbreak contingencies where incidents are detected. They should then look to any new legislation and statutory guidance to review the whole office-based business risk assessment, creating brand new controls and contingency plans. These might include education of employees, customers, visitors and contractors in order to adapt their behaviours and understand increased hygiene practices and social distancing etiquette. Strategies designed to control the flow of movement into, around and to exit the building using social distancing techniques. Changes to working practices to combine home working with shorter attendance in the offices to reduce cross-infection. Note, employers must invest in technology to facilitate effective home working. Adapted activities and use of different technology to cater for hygiene and social distancing etiquette. Regular deep cleaning of the whole environment and increased cleaning before, during and after each work shift. Infection control policy requirements. An infection control policy is required within every workplace environment. An infection control policy in an office setting will be different to one in a dentist or GP surgery or any other environment. However, all infection control policies will need to cover the same sections in order to ensure that the employer is able to eliminate, reduce, contain or manage a potential infectious situation. An employee or another person with a contagious illness, regardless of whether they entered a healthcare service or a building with office workers, could potentially put others at risk. An infection control policy in each work environment will be different, as the contents of the policy will be appropriate to the risks of reducing the spread of infection in that particular environment. Risk assessment plays a role in the control of infections in any work setting. The policy should include a requirement that the business assess infection control risks through developing and recording an infection control risk assessment. Risk assessment requirements. The legislation that covers the requirement to carry out risk assessments is the Management of Health and Safety at Work Regulations 2006. Regulation 3 states that every employer shall make a suitable and sufficient assessment of the risks to the health and safety of their employees to which they are exposed whilst they are at work, and the risks to health and safety of persons not in their employment arising out of or in connection with the conduct by them of their undertaking. An infection control risk assessment must be carried out to assess infection hazards and risks and ensure that, where possible, infection risks are eliminated, reduced, contained and managed appropriately. The infection control risk assessment will identify particular tasks that may carry the risk of contamination or the spread of disease. Required content for infection control risk assessments. The infection control risk assessment will need to identify the hazards within the offices and associated facilities, including those that potentially may be brought into the workplace. Decide who might be harmed and how, and include visitors, contractors, vulnerable persons, registered disabled persons, pregnant women, young persons, children, elderly, and those persons with medical issues. Evaluate the risks and decide on precautions through ratings such as low, medium or high risk. The precautions and controls put in place must be proportionate to the risks. An example is if the risk is high, then more robust controls may need to be put in place to reduce the risk to an acceptable level. Record the significant findings of the risk assessment and communicate it to all relevant persons. The law requires that the employer provide employees with adequate information, training, and supervision necessary to ensure their health and safety at work. Ensuring personnel understand the contents of the risk assessment and the role that they will take in managing any risk can be achieved through training. The type of training will depend on the individual, the sector in which they work, and the tasks or work activities that they are required to perform. Review the assessment and update when changes are required. Changes may be required following the identification of new or imported infection control risks into the office environment. Check and challenge. All businesses have a duty to revise the whole office risk assessment, controls, and contingencies during a time of pandemic. Some employees will have been involved in the risk assessment and design of the safe operating procedures and may be familiar with the requirements of them as a result. Other employees will need to be provided with the risk assessment and safe operating procedures from their office manager or senior team and will be required to abide by these when fulfilling their role. Make sure you are aware of your own duties and request information from your employer to make sure that you understand what is required of you. Request support and be proactive to stay alert, control the virus, and save lives. Thank you for watching. Feel free to watch as many times as you need or move on to the next part of your digital learning experience on your list.